Hello, everyone. My name is Lucine Kashikian, and this presentation is about chronic obstructive pulmonary disease. For this presentation, I chose a patient, a Hispanic female, 88 years old, who is retired and has two children and lives with her daughter and her family in Glendale. She has family and psychosocial support and has limited savings and receives a Social Security income. She was diagnosed with COPD and was admitted to the hospital for COPD exacerbation, shortness of breath, dyspnea, low oxygen saturation. Medical treatment included 2 liters per minute oxygen via nasal cannula and antibiotics through IV, such as Levaquin and Zosyn. Non-pharmacological interventions included relaxation techniques, sitting and breathing on tripod position. Clinical judgment and self-care capacity with chronic illness and treatment demand. According to an article published in British Journal of Nursing, COPD is described as debilitating disease that can progressively worsen breathing and eventually limit normal daily functioning by reducing the quality of life. Self-care capacity refers to patient's ability to care for herself. This patient was able to care for herself with minor help. She was living with her daughter and her family and was always encouraged to perform self-care activities as independent as possible. But at times, she needed a little help with activities such as showering due to her progressive weakness and shortness of breath with activities and increased dependence on oxygen. She was using her home oxygen on 2 liters. And she needed major help with her fine motor activities, IADLs, such as shopping, writing checks, cooking, sometimes turning her oxygen on, putting a nasal cannula, and taking her medications on time. Priority patient issues for discharge planning. The most critical components for the nurse case manager (NCM) is to do while transitioning the care for COPD patients from acute care to post-acute setting is to evaluate and decide the appropriateness of the patient discharge. Before discharging, NCM has to do an individualized and comprehensive assessment in order to understand patients' true needs, available support system, internal and external factors that can trigger COPD exacerbation and may aid in hospital readmission, and identify actual barriers to discharge. An appropriate discharge plan can detect and reduce the risk factors that could guarantee a readmission. For this patient, priority discharge planning includes medications on discharge, education before discharge, follow-up appointments, home health, physical therapy, a walker, and a home O2. Clinical judgment about what patient can be discharged. Due to difficulty of treatment regimen, NCM needs to ensure continuity of care and determine if the patient caregivers are willing to provide extensive care required by COPD patients. This patient can be discharged back to her daughter's house because it was safe and the daughter was willing to take care of her mother. Again, this patient needs minimal assistance with her ADLs. She could do most of them by herself and requires major assistance with AIDLs. And AIDLs are referred to patients' ability to perform more complex skills such as managing finances, handling transportation, shopping, preparing notes, using the telephone, and other communication devices, managing medications, doing housework, and basic home maintenance. Priority NCM strategy at patient level and system level. Patient level NCM strategy will be education, educating patient on medications, diet, oxygen use, compliance with respiratory therapy, and compliance with the treatment plan. And NCM strategy system level will be, to make sure upon discharge the transition back home is safe, provide uninterrupted and support care, provide resources to ensure her appointments with primary care providers are met, for example, transportation, and setting up home for home health visits. NCM strategy intervention at patient level. Effective management of COPD should be aimed at relieving symptoms, preventing disease process, and improving exercise tolerance. Other goals of COPD treatment includes preventing and treating exacerbation and complications, along with improving health status and reducing mortality. Nurse case managers play an important role in patient education. They should provide information and resources that can be used by the patient either in the hospital or at home. They promote effective learning, health promotion, and prevention, along with self-coordination, self-management that encourage the patient to be as independent as possible. They also work together with physicians, social workers, respiratory therapists, family members in order to provide excellent care by understanding patient needs and or barriers to healthy and for her health and well-being. For this patient, NCM should make sure she understands safe handling of medical equipment, in this case, her oxygen use, her disease management, being compliant with her medications, and follow-up appointments and physical therapy. NCM strategy intervention at system level. NCM ensures and coordinates patient care according to the care plan to ensure there is no need for repeat procedures. This is for reduction of costs and or hospitalization. If there are any gaps in patient care, NCM tries to address them as soon as possible so that it does not become a major issue. Once the patient is discharged, they do follow-ups to make sure they have appropriate resources such as medication assistance, transportation, respite care, nutrition assistance, housing, and much more. NCM makes sure that patients are referred to specialists and home health services. This collaboration helps to ensure continuity of care and make sure that all caregivers involved in this patient care are on the same page. NCM also ensures that the delivery of care is based on evidence-based guidelines and that the patient is at the appropriate level of care. For this patient, it will be beneficial to provide home health care, which was provided, transportation, education, and empowering the patient to participate in self-care as much as possible. Make sure she takes medications on time and has and understand the use of necessary supplies. Utilization review. The concept of utilization review in healthcare is constant. Utilization review is a process to evaluate medical services for necessity, level of care for appropriateness, quality, and the timeliness of discharge. It is part of the hospital quality program that looks into facilities efficiency along its resources and services and make sure they are utilized in the most effective manner. It prevents underutilization and overutilization of the resources and services, and make sure the resources are being utilized properly for the optimal patient care. This patient was provided with COPD education. Her symptoms were managed properly, and her medications were given on time. Quality and safety. NCM must identify potential problems and gaps that can disrupt patient care, help patients to return to healthier and more productive stage by providing high-quality care, and ensure that lack of care is not affecting patient safety and well-being. For this patient should be aware of potential triggers that can exacerbate her COPD. Patient is at risk for falls, so the uh, home should be checked by home health RN to ensure a safe environment. For example, lighting is adequate. There's no clutters when she walks. Patient should take her medications daily and on time. NCM effectiveness at patient level. An action plan was developed to help patients to manage COPD at home. A written material was handed to patient, which helped her understand how using low oxygen at home, taking medications daily and on time, using tripod position and pursed lip breathing can help her manage her COPD. The material was given in Spanish because this 88-year-old lady was an Hispanic lady. Education was provided based on her developmental and literacy level in order to produce positive patient outcome. Patient's daughter, who was very supportive of her mother, was also involved in the education process, so they both could have the skills and knowledge to deal with her mom's chronic illness. NCM effectiveness at system level, case management follow-up provides essential resources to the client to continue to self-manage. Nursing case manager ensures that patients have constant support, possible no hospitalization or less frequent hospitalization, and improve care coordination among care providers, proper services, and quality of care. And this is slide number 13, which is my references. Thank you very much and have a nice day.